I'm Diana Dooley, the Secretary of the Health and Human Services Agency for the state of California. This agency is peopled with the most committed advocates for the health and well-being of Californians. People throughout this agency provide service in a variety of ways, both through our county partners, through our nonprofit community partners, and through the help to people themselves. There are 13 departments in this agency, from protecting the public health to providing services through Medi-Cal. The Department of Managed Healthcare regulates the insurance industry on behalf of consumers. The Social Services Department provides a variety of protections and services, from child welfare to food stamps called CalFresh in California, licensing facilities to make sure they're safe and following the rules. We have the Department of Aging, the Department of Rehabilitation. We have two programs that serve those in facilities. The Department of Developmental Services serves those with developmental and intellectual disabilities that are in our state, run centers, as well as over 270,000 people that need these services throughout California. The Department of State Hospitals operates hospitals for the mentally ill. We have community programs through the Department of Community Services and Development. The Department of Child Support Services helps families get the support they need in those circumstances, and the Office of Emergency Medical Services, which played such an important role in the recent Napa earthquake. We've got several other offices in the agency. The Office of Health Information Integrity, that protects health information from breaches. The Office of System Integration, that works to coordinate all the technology that's required to get people's payments on time and to manage the vast information that we have. All of these programs operate through over 30,000 people in California who are committed to making lives better for those who are most vulnerable. In addition to the programs that we run through these 13 agencies, departments, and offices, we also have some very exciting innovations. We're responsible for implementing the Affordable Care Act. I serve as the chair of Covered California, which is the exchange bringing sellers and buyers of insurance together in a transparent, consumer-focused organization. We have an exciting new open data project where we are creating a portal where information that is both secure is also available for people to use for research and for their own needs. And 2 years ago, we pulled together a broad cross-section of Californians in a public-private partnership called Let's Get Healthy California, and developed a plan to bring California up as the healthiest state in the country by the year 2022. And this is mobilizing people all over California in local health departments, in private nonprofit organizations, in health providers and payers and plans and employers. It is very exciting, the work that we do in this agency, and is fueled by the energy of the dedicated people who do it. I started my own career in public service very many years ago and left and spent many in the private sector, and I was very pleased to be invited by Governor Brown to come back and do what I can to make public service the proud profession that it has been for me in my life.
Ladies and gentlemen, let's all put our hands together and welcome Diana Dooley, Secretary, California Health and Human Services.
What a pleasure it is for me to be with you for a few minutes this afternoon. The lineup has been terrific. I looked at the agenda and saw how many people that you're hearing from and talking to. I wish it could be interactive. I very much prefer question and answer and engagement, but I'll just spend a few minutes talking about one of the projects that we have in the agency about our Let's Get Healthy California and what that led to. Public-private partnership has been a high priority to me. As I said, I started my career in state I was a young analyst and went to the office of the governor in 1975 with also a young governor. I thought I was there on a temporary assignment, and I stayed 7.5 years. At the end of Brown 1 and 2, we've just finished Brown 3 and we're starting Brown 4, I left state service and went back to my home community in Central California. I often joke, my husband and I went to high school together, and we grew up in a small rural part of California, the heartland. And when we moved back, we moved to Tulare County. And having worked for Jerry Brown for almost 8 years, it was no secret I was a Democrat, but I was in the most Republican county in the state of California. And so I always joked that being a Democrat in Tulare County was like doing missionary work. But I learned on that assignment the real value change. I took the things I learned in state government and began to apply them in the local community. And I worked in nonprofits, and I had a business of my own, and I went back to law school, and I got back in healthcare as the Children's Hospital. So I was really the only person Jerry Brown knew very well in healthcare, so I got tapped to come back in 4 years ago. And part of it was my commitment to where we are to implement the Affordable Care Act. It's an extraordinary moment in time, and to have the privilege to help make life better for Californians truly is the compensation. I have a sign on my desk that came from the first chair of Brown 1 that said responsibility is a form of compensation. And people will either get it or they don't, but to me that says a lot about public service. We are here to serve the public, and we aren't always compensated as we should be, and we don't get the recognition that we deserve, but the work is very rewarding. Part of the reason that I was eager to come back and help Governor Brown turn California around was because of the basis that was formed for me in state service. And whatever I can do to foster leadership, we have a supervisors academy in our agency, we have a leadership academy in our agency. We just started with a program for analysts that want to move into leadership. It's extremely high priority to me, and I think the best way we bring honor to the profession of public service is by doing good work. The governor used to say the best politics is good government, and he is very proud of the people who have come to work with him now at this point in his career and in ours. As we turn the corner, I often get complimented when I go around the country about how well we've implemented the Affordable Care Act in California, and I often say, well, in the first place, it's only because they're great on the curve. We're not absolutely good, we're just relatively good, and certainly I'd rather be where we are than some of the other problems that have been experienced. But we also didn't have the partisan divide in California. It was initiated by a Republican administration, embraced, the exchange was begun, the low-income health program started in the counties that led to the Medicaid expansion. Regrettably, as you all know, we also inherited a $26 billion deficit. And the governor worked very hard to instill in the public the recognition and the respect and the need for the government services that we provide, and won in the Prop 30 campaign by a 10-point margin. That was not just getting the revenue we need to do the public's business, it was also telling the public what we do on their behalf. I am sick to death with the suggestion that government isn't the problem, isn't the solution, it's the problem. And sometimes it is the solution. It's the solution for things that we can only do when we do them together. It is the solution to roads. It's the solution to clean air. It's the solution to those most vulnerable that don't have anybody else that will fight for them and meet their needs. It's what we do together, and it's what makes me so proud to be a part of this administration and with so many thousands of dedicated workers. I'm also bridging the 30 plus or minus years I spent in between Brown 1.0 and Brown 2.0, which was in the private sector. And so when we did our Let's Get Healthy initiative, we brought together 40 of the best minds. I'm not the smartest person in any room. I always want to surround myself with people who know more than I do about any given subject. So I brought the 40 smartest people in healthcare and prevention and costs to look at ways we could make the triple aim a reality in California. The triple aim is better care, better health, lower cost. And we spent 6 months establishing some metrics. We have 39 indicators that we're measuring every year. Next week, we're going to be down in Oakland at the Kaiser Innovation Center for our 3rd annual convening of Let's Get Healthy. We're measuring ourselves every year, and we want to be the healthiest state in the nation. We also want to stop the escalation of costs. I don't say we're going to bring healthcare costs down. We're not going to do that. But we can slow the rate of growth, and we have done that in the first 2 years with the exchange at Covered California. We're doing important work, but we're doing it on the platform of the private sector and the market economy. That's important because we have to reach across the lines and not be isolated in one sector or the other. The governor's commitment to what we call realignment, which is really a finance term about the relationship of the money we collect that is needed at the local level that came after Prop 13, but working beyond just the funding between our county partners, the actual partnership with our counties, with crime prevention and moving some of the Affordable Care Act dollars into behavioral health and mental health and substance use disorders, so that people, when they come out of prisons, and they always come out of prisons, that we're trying to get the low-level offenders in the community and stay in the community and treat them in the community at earlier points. And that's been a struggle to get the right programs with the right funding in the right place. But fundamentally under all of it is our to work side by side, not top down, to recognize that there are lots of things that we can do better if we do them together. And that is at the heart of what we do in the Health and Human Services Agency. It's the spirit that I see throughout state government, and we work across many lines. The programs that I tried to summarize briefly in the little video aren't the only programs. Transportation and housing are important for the vulnerable. And so when we meet with the Child Welfare Council, or we have the Olmstead Committee, which is working to make people have the opportunity to live independently in their own homes, health and social service is a part of it, but jobs are a part of it, and housing is a part of it, and transportation is a part of it. And working across lines to integrate the services with the people who need them, recognizing that the need will always outstrip the resources. We never have enough resource to meet everybody's need, and what we see all too often is the segmentation of everybody getting into their own camp and corner and fighting for what they need for their population. And it's my job to try to step back from that and see what can we do, sort of the old adage of the greatest good for the greatest number. It leaves a lot of people unsatisfied, and there's certainly a lot of unmet need, but we are doing extraordinary work. We have 3 million people getting organized health care today that didn't have that 1 year ago. That's extraordinary. We reduced the rate of uninsured in California from 22% to 11% in 1 year. There is much more work to do, and we have lots of integration that isn't complete. We're working with our IT systems to build them up. We're working with our counties to get the resources that they need. We're starting on Saturday. We'll have our second open enrollment. Peter Lee, the director of the California, is going to 21 cities in California on a bus tour. You may have seen some of it. We are really working at the local level to make government real, to make people feel like the government is themselves, and it is we the people that are serving our neighbors and our friends and those less fortunate. So it's really a pleasure for me to spend a few minutes with you this morning, afternoon, or whatever time of day. You know, when it's 24/7, you just don't pay any attention to what part of the segment of the day that you're in at any given moment. But it is a constant inspiration to me to engage with people at levels of state service and to bring them together with the private sector. I always said when I worked in the private sector that there is a range of high performers and medium performers and low performers in every organization. It isn't special to government or large industry or small industry. You do the best you can with what you've got. Wherever you are, all of the old adages, you just make it work. And if you pick up every day and you figure out, what problem am I going to solve? One of the most overwhelming parts of This job to me is that I leave each day with far more unsolved than solved. And you have to look for the joys. You have to every day consciously think about what worked today? What did I make a difference? How did I influence something? Because it's all too easy to get caught up in what the problems are and what we need to do our job and how we don't have enough, and there is never enough in any environment. I'm 63 years old, and I've always said, I don't know what I want to be when I grow up. I still don't. I've also always felt like, I used to say, I was 24 when I worked for the governor the first time, that I don't know if I will ever outgrow the impatience of youth. And that's one thing I do know the answer to now. The answer is clearly no. I won't outgrow the impatience, because that energy and keeping up with this guy, 76 years old, he wears you out. He is so committed to California and wants the best for the state, and has for his entire career. I am very privileged to represent him and to do the work that needs to be done with partners and people like you here and throughout state government. So I really respect that you're here today. I appreciate so much programs like this, and we are doing it in our agency, and I'm working across the agencies to do everything we can to get the resources that people need to do the work, and to say thank you. We can't ever say thank you enough, and that is the main message for me here with you today, is to appreciate your work and be available to you at any point, whether you're in my agency or not. I think it's a real exciting time to be in government. We're turning some corners, and it's been hard. We took $2 billion out of this agency. They say when we were balancing the budget in the first 2 years, it was extraordinarily painful, and I don't think my skin is thick enough to do that work, but we did, and we made it, and we turned the corner, and now we have to hold on to the gains that we've made, and make a difference in people's lives. So again, it has been my pleasure to spend a few minutes with you. I would much prefer to hear from you. That's not the format today, but I invite you to be engaged at whatever level works for you in state government and in your communities. It's an important bridge that we have to make people believe that the government is working for them. So thank you, and enjoy the rest of your day. could make the triple aim a reality in California. The triple aim is better care, better health, lower cost. And we spent 6 months establishing some metrics. We have 39 indicators that we're measuring every year. Next week, we're going to be down in Oakland at the Kaiser Innovation Center for our 3rd annual convening of Let's Get Healthy. We're measuring ourselves every year, and we want to be the healthiest state in the nation. We also want to stop the escalation of costs. I don't say we're going to bring healthcare costs down. We're not going to do that. But we can slow the rate of growth, and we have done that in the first 2 years with the exchange at Covered California. We're doing important work, but we're doing it on the platform of the private sector and the market economy. That's important because we have to reach across the lines and not be isolated in one sector or the other. The governor's commitment to what we call realignment, which is really a finance term about the relationship of the money we collect that is needed at the local level that came after Prop 13, but working beyond just the funding between our county partners, the actual partnership with our counties, with crime prevention and moving some of the Affordable Care Act dollars into behavioral health and mental health and substance use disorders so that people, when they come out of prisons,